Good afternoon. I want to welcome you all to the Washoe County District Board of Health meeting. Sorry for a little delay. We had a little technical problems. I'm Dr. John Novak. I'm the vice chair. I will be filling in for Kitty Jung today, the chairman. So, Madam Secretary, can you call the roll and determine quorum, please?
Yes, sir. Chair Jung is absent. Vice Chair Novak?
Here.
Oscar Delgado? Here. Dr. Hess? Here. Christopher Dare?
Here.
Michael Brown?
Here.
Tom Young?
Here.
We have a quorum.
Good. Thank you very much. Charlene, can you lead us in the pledge, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We now come to public comment. I have one public comment, Mr. Pitkin. You have 3 minutes, sir.
My name is Michael Pitkin. I am a homosexual, HIV positive Satanist, and no, that does not automatically make me a pedophile, a murderer, or a rapist. I advocate for myself and other patients' rights through acts of compromise and peaceful coexistence. After 15 years of living with HIV, I have medical experience. It is the patient who has to live with medical conditions and side effects, not the medical care providers. Tori Skok-Dopel at Northern Nevada Hopes referred me to Dr. Wilson, cardiologist at Renown Health. Dr. Wilson ordered blood labs. Renowned phlebotomists are not contracted with Quest, Medicaid Health Plan of Nevada. I went back to Hopes where I always had labs drawn. My HIV positive blood specimen came up missing. It turns out Hope's phlebotomists only contract with LabCorp, but continue to draw for uncontracted Quest. Accidents can happen. I requested from Hopes in writing a possible accident happened. Hopes refused. My inquiries resulted in Hopes administration and the Hopes board saying I made it up. The state of Nevada licensing concurred. I also inquired about other medical records and communications under the Freedom of Information Act, and again, I was refused. I was told they did not exist, and again, I made them up. Hopes retained Alice Campos Mercados at Lemons, Grundy, and Eisenberg. I was then discharged from all medical care. Last year, I went to over 37 appointments at Hopes. I have slip discs number 4 and number 5 pressing on my spinal cord. I do not want surgery for the times I'm in pain. I just want pain meds. All last summer, I went to physical therapy. Hope psychiatrist Sadie Altonson, without checking with my past history, declared I'm a pain pill addict and it's all in my head. You potentially have HIV positive blood out there in your community. I ask you to look at area security strategies, ethical standards of bias, methodologies for medical error, clinical best practice guidelines, and health informatics. Thank you.
Thank you, sir. Okay, next item on the agenda will be approval of the agenda for the meeting today. I have been requested to put a hold on item number 9, reschedule it. This was a request done by Chairman Jung for this presentation, and I would, if possible, have you approve that we hold it for the next meeting.
Need a motion? I move to approve the agenda, removing 9 for the next meeting.
Good. Second. It's okay. Mr. Dare is first, second by Mr. Chief Brown. All in favor?
Aye.
Good. Aye. It passes. Any opposed? Okay, good. We'll hold off on number 9 for the next meeting. So, okay. Recognitions. Mr. Health Officer.
Thank you, Dr. Novak. We have a number of people that we're recognizing today, so I'd like to recognize each of these individuals, and then we'll start taking pictures. So if you're being recognized, stick around for the pictures that we'll do at the end. And I'd like to start with a years of service recognition for Joshua Ristori. Please stand up, Josh. Thank you. Mr. Ristori has been with the Air Quality Management for 5 years now, so we very much appreciate your service for the Health District. Thank you. And congratulations. And we have several new hires, and so I would ask Mr. Cutts if he could introduce the new hires that he has in CCHS. And first we have Deborah McLaughlin, who's a medical billing specialist. While a new hire to CCHS, she's not new to CCHS, and I believe that Mr. Cutts can explain that for us.
Yes. Is this on? Good afternoon, Chair Novak and members of the Board of Health. Steve Cutts for the record. CCHS is pleased to announce and welcome Debbie McLaughlin as our new medical billing specialist for CCHS. Debbie has 8 years of billing and coding experience. In addition, Debbie is a certified coder with the American Association of Professional Coders. For the past 18 months, Debbie has worked for CCHS in billing as a temporary employee. During that time, Debbie learned CCHS's billing system and has been instrumental in helping the team clear out the backlog of denied claims and ultimately help to increase our revenue. Debbie's positive demeanor and willingness to do more are great assets, and we are very happy to have Debbie as a permanent Washoe County employee.
Welcome.
Very good.
Congratulations. And next we have Jessica Connor. Public
Yes,
Health
we welcome Jessica Connor into our newly established public health investigator position within the HIV program. Jessica has her Bachelor of Science in Community Health Science with a Master of Public Health, both from the University of Nevada, Reno. She comes to us from the Nevada Division of Public and Behavioral Health, where she has been working as a health facilities inspector since 2014.
Congratulations. And then we have a number of Shining Star recipients this month, and as you'll recall, the Shining Star is our recognition program that the county has for employees that are providing excellent customer service, either to external customers or internal customers. And so first I'd like to recognize Ms. Lori Griffey. Lori, please stand up. Lori is the recipient of 3 Shining Star nominations, so congratulations and thank you very much for your efforts, Lori. We have Holly McGee. Holly, please stand up. Congratulations, Holly. Holly's been recognized by, actually I'm not sure if this is internal or external, and Lorena Solario. Lorena, congratulations on your Shining Star recognition. And Judy Medved Gonzalez. Judy, I don't think Judy. Okay. So we had, we have limited staff in our TB program, and so we thank you, you two ladies, for coming over to join us today. And then we also have Samantha Beebe. Samantha, congratulations on your Shining Star. And Carmen Mendoza, who I believe you've seen before. Please stand, Carmen. Congratulations. Carmen now has 10 Shining Star nominations, and that is the most that anybody in the county has received.
Does she get to go to Hawaii now?
Not. I think you need 1,000 at least for that.
You're on your way.
I'm afraid we're going to have to start paying them one of these days, too.
But congratulations, Carmen. Excellent job. So with that, we're done with recognitions, and we can take some
pictures,
photos.
please.
Yes. So I've got some hardware I've got to
Thank you very much. Thank you. Take all the things for the sheet over here.
Shining star, woo!
Okay, on three, one, two, three. And one more, hold on. On three, one, two, three.
Okay. Right there, right in the middle.
Okay, on three, one, two, three. And one more, one, two, three. Great, thank you.
Thank you very much for doing a thankless job. We're glad to have you. Thank you. Uh-oh, usually when we're gonna have to start doing something, payment or something.
Okay, on three, one, two, three. And one more, one, two, three. Great, thank you.
Good, congratulations. All right. You betcha.
We're gonna knock y'all at once.
Too bright, too bright.
Still have big enough lens for this.
Okay, on three, one, two, three. And one more, one, two, three. Great.
Good, thank you, ladies. Good job. Technical difficulty there. Operator error. I'd hang in there too.
Okay, on three, one, two, three. And one for the operator, one, two, three.
Thank you. All right. Yeah, just black. Thank you.
Nice.
Okay. Next item on the agenda is our consent agenda. Do I have anything that we need to pull off the consent agenda for any individual considerations? Or I will entertain a motion to do the consent agenda as is.
Move to approve as is.
Thank you, sir.
Second?
Second, good. Motion made by Mr. Dower, Mr. Young for a second. Any discussion? If not, all in favor?
Aye.
Opposed? Nay? It passes unanimously. Thank you very much. Okay, booming right along here. Okay, item 7 will be Ms. Heidi Parker. We're going to talk about fighting flu in Washoe County. I hope it's a better fight than last year. What an introduction, right?
Right? Thank you, Mr. Chair and board members for having me here today. For the record, I am Heidi Parker, Executive Director of Immunized Nevada. So today I'm going to talk with you a little bit about just some of the efforts to fight the flu here in Washoe County, the education, outreach, and access to vaccines. And then I'm available to answer questions as well. So obviously when we're looking at talking about fighting the flu, we're all very aware of last flu season and how severe it is. And so we want to keep that in mind as we're looking at this season's efforts.
Thank you.
Does this work? Oh. There we go. So overarching challenges that we see during flu season, so there is a broad recommendation, so that 6 months and older does make it challenging with getting that message out because we're literally marketing and getting everybody in our community educated. And so that is really challenging to try to drill it down to some of those key audiences. Additionally, we have had reduced budgets that have impacted the availability for no-cost flu clinics. Some of those clinics in the past were funded through a community voucher program through retail pharmacy. That was a national program, and that program was severely cut last year, and so we did not see the number of vouchers that we have in the past. And that really affects those who are facing barriers in their ability to access vaccine. Additionally, I think we're all pretty aware of the fake news versus reality with misinformation. That's always part of flu season, but last year there was definitely inaccurate media reports around vaccine effectiveness, and then of course that was coupled with the seriousness of flu season, which made it definitely more challenging. So I'm going to talk a little bit about what our flu rates were for last season. This data is from Nevada WebIZ, so it's based on doses entered into our immunization information system, and that is dependent on timely entry. So while we know it's a state law to enter vaccines, some providers do struggle, so this is definitely a snapshot, but it's a good reference point. So for our whole state, we saw about 2/3 of vaccines administered before November, so that was positive. And then you can see some uptick around times when flu reports were being reported in the media and that severity was being realized. The good news about flu season last year is we did see 13.6% increase over what was reported last flu season, so that is definitely a positive. When we look at Washoe County, this is the number of people, and so the other data was actually number of doses. Some children require 2 doses, and so this is actually just the number of people. So again, positive news, we were up 11.6% over last flu season, roughly 30% of the population. That's hard to drill down to just because of flu vaccine being recommended for 6 months and older, kind of trying to carve out that small population of babies, but generally 30-ish percent. When we look at overall data for the US for all ages, we had 46.8% in the 2016-17 season. Our data was 36.1%. That estimation for the last season will be released next month. Some childhood data was actually released today. And so Nevada is not doing well with childhood data based on what was released today. And so we're definitely about that same 10 percentage points or so below for children. So who's vaccinated in Washoe County? So there are multiple types of healthcare providers. They are really vaccinating throughout that entire August through June. They provide vaccine as long as they have it in stock in a wide range of provider types and locations. So we know that people here in Washoe County have plenty of options for where they can get vaccinated. And if you obviously shop at the grocery store or go to a big box, you know that it is readily available. Nevada benefits from the ability for pharmacists to vaccinate children. So those pharmacies all have different policies on the lowest age that they can vaccinate. Some are as low as 3. So we always tell parents that they should ask at the retail pharmacy. It's a great option. It's accessible in the evening, on the weekends, maybe a lot easier to get into with a provider appointment, since we know that can be challenging in this community. So lots of opportunity in our community for vaccinations. So what's happening for flu outreach? So Immunize Nevada has a flu-specific grant through the state of Nevada. That grant is for statewide activities each year. This coming flu season, we have about $131,000 that we work with to cover the entire state. So the activities I'm talking about are within that budget. So obviously not a lot of funds, and we do our best to maximize those and stretch those resources. So some of our key activities, we send a reminder card to all households with toddlers who haven't yet received a flu dose by November. So we want to make sure if people haven't done it yet, they get that reminder that it is important. It's important for the whole family. We would like to expand this age group this year, and so we're hoping to do that again in November with a larger group, because we actually know that some of those older kids are as at risk for hospitalization and death. We partner with local Community events and health fairs, if we can, we try to bring a vaccinator on site, but if we can't, we're at those events, we're talking to people, we're giving them referrals, we're telling them how to pay for it if they're not sure, where to go if they're uninsured. And our vaccinating partners at those clinics are retail pharmacy partners in town, as well as our Washoe County Health District nurses. So it really depends on the event and who we think the population is, if it's going to be high uninsured or if there's going to be an insured population there. We do a lot of advertising, so we do flu-specific Facebook ads, lots of messaging on social media. We have a partnership with Nevada Broadcasters Association, and so that provides us substantial value in advertising on TV and radio. And so last flu season, that value was over $1 million that we realized. And so that is of huge benefit to our whole state, and we really could not advertise or promote that message without their partnership. Clicking. Thank you. Additional activities, so we have wall stickers, you might have seen them here around the county. Those are distributed to a number of target audiences and businesses, and they really promote those other covering a cough, washing your hands, and then getting vaccinated. And we produce those in English and Spanish. And then we have bookmarks available for various populations. So again, English, Spanish, and we distribute those wherever we can in the community, including some schools as well. And then online, we do smart targeting and geolocation. So if someone is maybe checking into an urgent care or they're near a hospital, we geolocate keywords that they might be searching for, and then our ad about where to go for information and how to get to our website pops up for them. And then our website has substantial amount of information for the community about flu season. So this is our PSA that's running with Nevada Broadcasters.
Where does the flu come from? I mean, we know it comes from the influenza virus, but how does it get to you or your child? The fact is, the flu virus is everywhere during flu season. And the best way to protect yourself and your family is with a flu vaccine. Getting vaccinated is easy and way better than getting the flu. Find the clinic location nearest you at immunizednevada.org.
So that PSA is running in both English and Spanish, and then there is a radio version, and then we also have 15-second versions that we use on social media. Our target audience is really trying to help people understand the importance of kids and their potential for spreading disease around the community. So we also have it on our YouTube channel, and so it is shareable and used that way as well. This is an example of the postcard we send, so it is bilingual, and it is not only about protecting the child in the house, but also for the whole family. And then this is the sink sticker imagery, so it can go right over that sink where people are reminded to wash their hands. And then the bookmark on the right is our more like youth, college-focused message. We have one for parents, and then we have general one as well. So those are just some of our campaign materials. And then for education, we also do clinical education and work around K through 12 outreach as well. So for healthcare professionals, we want to make sure that they're making a strong recommendation. We know that that is a key reason why a lot of people do get vaccinated, is because their doctor or healthcare professional told them to, and that it's important. So we do monthly webinars. So during flu season, we include flu education. We have an annual Nevada Health Conference that we do, and we always have influenza workshops there. We have provider toolkits, and we also have other clinic materials that are available. And then we give out silver syringe awards for health care organizations who have personnel vaccination rates above 90%. So you would hope that everybody achieves that goal, but unfortunately we have a lot of organizations that have not. It's getting better every year. And so these are some of the messaging that CDC is using. They're very focused on healthcare professionals this flu season and giving them the resources they need. The other piece is that we need healthcare professionals to also lead by example, get vaccinated, be educated, not believe misinformation like the broader community. And so we provide that to them as well around education. Since 2009, we've done school-located flu vaccination clinics here in Washoe County, and so We mostly focus on Title I elementary schools. We do others as well, depending on scheduling and staff and resource availability. This year, actually for the last couple of years, Renown Health has been a key supporter of those programs to ensure that we have the funding to continue them. And then it's a key partnership with the school district and the health district here as well. The value of this program is really helping us reach some of those vulnerable communities, some of those zip codes that we know are struggling for access to care and other social determinants of health. And so by bringing flu vaccine on site to these schools, we really help the schools stay healthy, kids learning in the classroom, not at home sick, parents not having to miss work and have some of those economic effects as well. And so this is a great program we're really proud of. In the last couple of years, we've added a healthy classroom item drive in the community so people can donate tissue, hand sanitizer, wipes. And we know teachers are buying these materials and we don't want them to have to do that. And so we're collecting them, people can donate them at a number of locations, and then we provide them to the schools that we are working with for vaccinations. And then this year, we have a new partnership with Public Health Preparedness, and so we are working with them to print a couple youth-focused education materials. So the CDC has this great new graphic novel, The Junior Disease Detectives, and these kids go through a process of finding out why one of their classmates got sick, and then we also have a elementary-focused coloring book for the younger kids. And so we're working with them to produce these, and then they'll get distributed at these schools that we're working with. And then the graphic novel actually has teacher classroom resources that go along with it, and we'll be providing those to the teachers to utilize as well. So this is a kind of positive from last flu season is CVS did do a survey, and 1 in 5 people said that last flu season is hopefully going to motivate them to get vaccinated this year that they didn't last year. Hopefully this plays out. We would love to see obviously more vaccinations in this community. We are typically at the bottom of rankings in our immunization rates in the country, and I think we can see that in our number of cases and unfortunately some of our the deaths that happened last season. So we want to make sure that people do understand the importance of getting vaccinated. And ways you all can help us fight the flu is, again, leading by example. So when you get vaccinated, just share those photos on social media. They do really make a difference. Just normalizing that process and showing people that all of us are doing it really helps those personal stories. If you have employees, support them with time off to get vaccinated. You can bring a clinic on site. Also just ensure that they have the ability to stay home if they're sick. That sick time and that permission is really, really important. That CVS survey, unfortunately, has terrible numbers in it about the people that say that they still go to work when they are sick. It's 60 to 70% of people. So we don't want that happening because especially if you're in a business that you're interacting with customers, the potential of your customers getting sick from your employees is high. Encouraging friends and family to get vaccinated, and then flu vaccine just doesn't protect you, it protects your friends, your family, the people you're encountering in our community, and the more that we are vaccinated in our community, the better protected we are, and hopefully the less cases and spread of disease we see. This is really one of those things that you can do to give back. So thank you for your time, and there's my contact information.
Any questions or comments for Heidi?
Very good.
I do.
Go ahead.
Yeah, I have a couple questions. One is, are you going to do a presentation for Sparks? I'm sure Reno would, only because we have so many people who watch that, and it would be a very easy, good way. Do I need to invite you officially, or are you already on the roster?
I am not on the roster, and I'm happy to do that.
So I think it'd be wise to hit each of the things, even Washoe County, when they have their meetings. Just not that, I think we all kind of know what's going on, but all the people watching, it's good to get that information out. The other thing, you mentioned the cost, and I just want to be clear. Does that mean you don't have enough to give free vaccinations to people when you said the cost is there? What does that mean?
For running clinics in the community, is that what you're asking?
Well, you just mentioned that you have less finances coming in, and with less finances coming in, and then you talked about all these things we're doing. Does that mean you don't have the money to do them, and we hope to, or what does this mean?
So with this school-located vaccination clinic project, so we do have that fully funded this year because of Renown Health. All the other community clinics that have happened in previous years, we've had clinics in a number of locations. Those have been reduced partly because our retail partner, our pharmacy partner, did not have those vouchers. So those vouchers used to just provide a free flu shot to whoever qualified. And so without those vouchers for the uninsured population, it's a little more challenging to get them access because they have very limited places they can go. So if we can go to them, it's much better, if we can bring flu shots. So we are continually raising funds to try to support community sites. We do have some additional funding that is supporting a clinic at the Northern Nevada Children's Cancer Foundation and places like that, but it's definitely less than we have been able to do in the past.
And then my final thought goes into my final question. So you also mentioned that you have $131,000 to do these events. That's not very much money to do events.
And actually, that's across the state, and that money is actually not for events. That is for our Broadcasters Association partnership. It's for all the materials we produce. It is for the advertising online and both social media. So anything that we're doing that's outreach focused, that all comes out of that money. Our event budget and for staffing, that comes out of just regular Immunize Nevada budget that's just because it's a priority for us.
So I just want to share it to us. I have a question of, should we be more involved instead of just saying we don't have the money? Is this something we need to talk about as a board? Because who this is going to affect is not, it's those who are uninsured. And so we are at a place where I think that we might need to look and see what possible funds we have that we can come alongside and help compensate. I don't know what the protocol for that is, but I think that I don't want to just watch, we have an accident coming. It'd be good ahead of time now to start talking about this. I don't know if I can ask Mr. Dick if you can look into maybe our next meeting, or I don't know of what could that look like, what kind of needs is actually there. But I think if we know this is coming, I don't want to sit back and say, well, that was rough. I'd rather help.
I think we have a great partnership with the health district here and the nurses and the program. One of the challenges is that the health district is contracted with a number of insurance companies, but they're not contracted with all. We have people in our community that are challenged with how to access care even though they are insured. And so when we are at these clinics, it is actually insured people showing up too. So the best way to describe it is we're actually kind of subsidizing those because they don't know where to go or how to access that. And the benefit for us when we do have funding to cover those clinics is then we're not turning somebody away. We can serve them. So for whatever their reason, if they can't make it during the day because they're working or they're working 2 jobs, if this clinic on a Saturday is their best option, we want to be able to serve them. And so that's where the funding comes in, is to cover the cost of that vaccine and the personnel time and all the other things that it does take to run a community clinic. And I think the health district here has done a great job in partnering with us and continuing to try to do the best with the resources we do have available.
Thank you.
Okay. Mr. Dick?
In response to Councilman Dare's question, I think this would be appropriate for discussion during the board workshop that we've got scheduled for November 1st. We'd already planned on some discussion about how we might spend some of the fund balance that we have. So rather than bringing that separately at the next meeting, I think it would be just another week later, we could be discussing it during the.
And it works under our existing budget the way it is now.
During the board workshop.
Yes, sir.
Currently, even if you don't have insurance, you can come here and get the flu shot, right?
That's correct, and
Yeah.
I would leave it up to Mr. Cutts to provide details on that, but.
Yeah, okay.
What is the cost of that? Let's say you're an uninsured person and walked in the health department, I assume that's a pretty good deal. I mean, what is that, would that cost someone?
Why don't you come up?
Well, we're going to pass that all the way to the back of the room. Sorry, Linda.
Linda Gabor for the record, Gabor. I'm the supervisor for the Immunization Program. The cost for administrative fee for a flu vaccine or any vaccine is $21.34. If someone does not have insurance or the ability to pay, that would be waived. If someone is
So
uninsured or
we're not
underinsured.
turning anybody away.
Well, that's good.
$20.
I think it's a good thing what Mr. Dick put.
Yeah.
Let's talk about that at the November meeting. It's
a great
Because that would be an impact to our whole budget, so.
I think I only have one final question. If someone wanted to give $1 million right now, how would they do so?
To Immunize Nevada.
Do they just go online and there's a donation place?
That would be amazing if they put $1 million donation online, but they can also issue us a check. We are a 501c3 nonprofit, so we have a number of ways that actually people can support our program. So you can donate online, you can work with us on a corporate sponsorship. We are a grant, heavy organization, so we do write a number of grants. We have lots of opportunity.
And if they did give $1 million, we'll give them a shining star
That would be
today.
amazing.
Maybe two.
Done.
Mr. Dick has one more comment.
I just wanted to thank Ms. Parker for being here and for all the work that she does on behalf of Nevada. We're very fortunate to have Ms. Parker leading Immunize Nevada. They do great work, great organization. She's passionate and a tireless advocate for vaccinations, not just flu vaccine, but shaping vaccination policy in Nevada, watching for things that might hinder or harm people's ability to get vaccinated. So I just really appreciate having Ms. Parker here and the partnership that we have with Immunize Nevada. So thank you very much.
Thank
I
you.
do have a couple questions. Why is Nevada so low in immunizations? Is there one thing out there, or is it just Nevada's tradition, we're not going to go get a shot for anybody, or?
I think there's a number of issues, so I would like to share that just in general for childhood immunizations, Nevada has made great strides over the last decade. I think a lot of that can be attributed to the impact of the ACA, and so we see rates increasing post-ACA. So I think that access to care is a really big part of the equation. I think we, along with just flu vaccine, flu vaccine is challenging. You have to get it every year. People don't understand it. There's a lot of myths and misconceptions. And so overcoming those, it's a long haul, and we start over, I feel like, every year. So that's our goal, is to just continue to work hard to help people understand. We talk about health literacy. We really work on vaccine literacy to make sure that people can understand the science, and hopefully we'll see those rates increasing like we did, from this last flu season. That's a big jump, and that's something for us to be proud of. It still puts us pretty low, but it's still, it's a good increase.
One other question. What do you expect this year for the flu season? And I know this is just a wild thing out there, but we've had enough negative stuff in the media. They've said, well, it basically didn't work last year. Well, it did and it didn't, depending on whether you got the flu or not. And what do you think is going to happen? What's predicted to happen?
So I learned this from Lenny Shore here at the Health District. So I always say that the most predictable thing about flu season is that it is unpredictable, and it is very, very difficult to know what's ahead. I think my hope would be that last flu season really helps people understand the severity. We're also at the 100th year anniversary of the 1918 flu pandemic, and I think that's really important to remember. My great-grandfather died in that pandemic. We've come a long way with the resources we have to prevent influenza, and I think we need to keep that in mind, that there's still always that possibility. We saw that in 2009 with H1N1. So my hope is that we learn from last flu season that people do take advantage of the vaccine and the opportunities that they have to get vaccinated in our community, that they do it sooner rather than later, that they don't wait until we have terrible reports in the media and then there's a mad rush to get vaccinated. If you do it now, then you don't have to worry about it.
Good statement for the TV coverage, too.
Thank you.
Thank you. Okay, anything else? Okay, thank you very much.
Thank you for having me. I
that.
appreciate it.
Okay, item number 8 is going to consider putting another representative or a replacement representative to the Regional Medical Services Advisory Board. Ms. Conte.
Good afternoon, board members. The EMS Advisory Board, as you know, is the overseeing board for the EMS Oversight Program created through that interlocal agreement. And two of the positions on the board are District Board of Health appointees. They are the emergency room physician, currently held by Dr. Michelson from St. Mary's, and then the hospital continuous quality improvement representative that is being vacated by Terry Ward from Northern Nevada Medical Center. Ms. Ward has served on our board for 4 years. She recently received a promotional opportunity within her company, and so she is not seeking appointment to the board. So we put it out to get some applicants, and you have 2 applicants in front of you. I'm not going to say their names because one applicant, I can't pronounce her name. So you have 2 applicants in front of you. Both are extremely strong. Both of them have a wonderful resume behind them. The EMS Oversight Program is recommending that you appoint Mr. Joe Macaluso to the position based on looking at resumes and correspondence. We believe that he has the stronger background at this time. The other thing, just as a side note, is that our other applicant is also from Northern Nevada Medical Center. So this would give the opportunity for Renown to have representation on the board because they haven't for the last 4 years. But the board, it's your appointee, and so we will leave it to you.
Good. We're open for discussion or a motion.
I'll make a motion, we go with staff's recommendation to appoint Mr. Macaluso to the Hospital Continuous Quality Improvement Representative for the Regional Emergency Medical Service Advisory Board.
Okay. Motion, Mr. Brown. Second?
Second.
Okay. Second, Dr. Hess. Any other discussion? If not, a vote. All in favor?
Aye.
Aye.
Opposed? Carried unanimously. Nice
Thank you so
job.
much.
Okay. Comes to number 10. That is me. For those that do not know, I am on the executive board of NOWBO, which is a national organization for health boards. I am the treasurer, so I've got a pretty good grasp of what's going on. We had our conference in August. It was absolutely phenomenal. It was in Raleigh. It was hot and warm for people from Nevada. It's pretty humid place to go. We had a record attendance. From what we've done, we've had to reconstitute NOWBO over the last 4 or 5 years. There were some financial problems that had put us deeply into the red. We've had some very dedicated people over the last 5 or 6 years that have revived the whole organization. And the reason I'm bringing up revives the whole organization, we had the executive director of both NHO, which is the Health Officers Board, and ASTO, which is the regional territorial other health boards, came to our conference along with 2 other, national board people from different organizations. And the alliances that were being carved out and worked on, because now NOWBO is in a very established position to move forward. We're no longer, well, maybe they'll survive and maybe they're not. No, we've got really big membership increases over the last couple of years. Even since August, we've had a bunch of new people joining the organization. And it is an organization for actually health board members to educate them. We have a lot of educational opportunities. Every year at our conference, we do basically a 101 for all the new members of health boards to get them online. We also offer a program within with the help of the University of Michigan to actually put out materials to train health boards, and that might be something that we need to do as an adjunct to what we already do for board organization orientations. And I don't know if anybody knows, but we get a pretty substantial set of discs to go through training material for our own board members. But this is a very well done. We will have our next conference in Denver. It is a little bit different formatting. It's in the past, it's always been in August, which always has conflicts with every organization, whether you do it in August or December or whenever. We're looking to do something that may have an area that's a little more friendly family oriented than Raleigh, North Carolina, but it's something. But we've also moving it to more the center part of the country with good air service. And that seems to be, by our own surveys, a problem with our organization, and I know that's a problem with a lot of organizations. Good, easy air access to get in and get out. We've already contracted there, and that should be a great conference. I think I'm going to hop on Amtrak and go to Denver for that one, so I'll invite you all to come along. It should be a really good conference, but I think we've made phenomenal progress in the last 3 years since I've been a board member in that organization to turn the organization around, and now all these other organizations all of a sudden want to, hey, let's sit down. And the marriage of these 3 different organizations, really we're all looking to do the same thing, just from a different perspective, and that gives us a lot of different representation abilities when we can go say, okay, we represent public health in the United States. So all of a sudden, some of the legislatures and money people all of a sudden want to talk to you in a different way, saying that, no, we're just from the health board, or we're just the health officers. Now it's public health. So great meeting. Encourage you all to come to Denver next year.
What's the
That's
date?
it.
When?
It's the second weekend of August. It should have been in the publication that Laura forwarded you today from the NOWBO. And I think registration opens in a couple weeks, but you can already do hotel reservations, so. Good.
What, is this going to have the same name, or is it, because is it an actual merger of the 3 organizations, or is it?
At this point, Dr. Hess, it is a conversation.
Oh, okay.
And the reason I'm phrasing it that way, there is no formal proposal.
Yeah.
There is a big joint meeting of all the leadership from all the organizations. Will be held, I believe it's the first weekend of March this next year, to see where we want to go, how we want to do this. I don't picture anytime soon being one total organization because of the backgrounds of where we are.
Well, in some respects, it might be good to be together, but still separate organizations.
And I kind of picture that's going to be it.
What we're looking at is a little different than what the health officer's looking at.
Yeah. And this is just now a position where we can present a united front.
Yeah.
Where in the last couple of years, it's been 4 separate little organizations all talking in different directions, so.
Good.
Very good. Okay, that is my report. Ms. Albee.
Good afternoon, Mr. Chair. I'm so used to saying Madam Chair, I have to really do
good.
Members of the board, for the record, Charlene Albee, I'm the Director of the Air Quality Management Division. The agenda item you have in front of you today is consideration of the adoption of a business impact statement that's been prepared to look at a potential general Title V permit program that we're establishing for air curtain incinerators. Anybody that doesn't know what an air curtain incinerator is, basically it's a steel rectangular box. It's 4-sided, sits on the ground. It has an engine associated with it and a fan that runs over the top and basically makes a blanket. Like when you walk in a grocery store, that air curtain that you walk in, this is a horizontal one. There's a flame in the box, and debris can be put inside to the box, and it burns it at super high temperatures because it keeps everything inside underneath that air curtain. So you can dispose of a tremendous amount of waste, green waste particularly, with very little ash. The reason we're bringing this forward is Truckee Meadows Fire has purchased an air curtain incinerator. The intent is to relieve some of the local pile burning. Last year they had about 13 fires, I believe, that were escaped, that they responded to as a result of people open burning in their backyard, and it got away from them. The investigation into what would be necessary to permit one of these, we realized and were informed by EPA Region 9 that they are required to have a Title V permit, which is a federal permit under 40 CFR Part 70 of the Clean Air Act. Just to put it in perspective, a normal permit that we would issue for a regular stationary source, we turn around in less than 30 days. By regulation, we're allowed 18 months to do a Title V permit because of the amount of the work that goes into it, public comment periods, a lot of back and forth with EPA revisions and review before we can issue these. The nature of the air curtains is that we're trying to increase public safety. We're trying to increase, provide benefits to public health so that we don't have the smoke out, that we don't have all of these going on. We realize that we need to be more responsive. So by doing a general Title V permit, we'll be able to actually turn one of these permits around within the 30 days that we do a normal permit, because we're doing all of this work up front. The modifications to the regulations that are covered by this business impact statement will ensure that we are issuing permits in compliance with the federal regulations, and that in turn, the people that have the incinerator, the air curtain incinerators, whether they're land managers, private companies that want to do debris cleanup, or anybody that wants to run one of these, they now can go in a reasonable amount of time and be able to set these up and operate. The second part of the program is that we looked at the fee. Application fee for a Title V permit is about $36,000 because of the effort that goes into the review, the staff time, the publishing, public notices. Again, doing all of this up front, we were able to take the fee from that amount and save over $30,000 with a proposed fee of $2,873. That makes it now financially feasible to have these operating. The business impact statement essentially says we're expediting the processing, we're ensuring compliance with all the federal rules, and we've made a significant benefit financially for any organization that would like to operate one of these. So that's basically the summary, and I'm available if there's any questions.
Questions?
I actually sat down this morning and tried to go through the lined out one and tried to somehow compare it to the new wording of this.
It's difficult.
Do you have, can you tell me in 1,000 words or less, what's new and what's different? This is overwhelming.
It's been a huge project. We've been working on it for almost a year now. It got to the point where it was easier to cut out the old and reformat the new. The references in our local regs, we have to reference the federal. A lot of those had changed. We have NRS changes, we have federal changes. It's a lot to reference back and forth. Since we are delegated authority through Region 9, we adopt most of the program by reference. It is detailed out though, so that it's easier for our constituents, our customers to read, for people to know what they have to do to be in compliance. Because we can take a federal law that's 500-600 pages, pull out the high points, adopt it into by reference, but then highlight the pieces of our program and basically our business process we have to go through. So that's what you see in the proposed regulations. The same information is there. We've just now allowed it to be a little clearer. And we did, in the old regulations, there was one paragraph that said general permits can be issued. So now we've set up the program where you can see what you have to do to get the general permit issued.
That makes some sense.
It's overwhelming the amount of
It is, just to
paper
look at it.
to say what you just said.
Yeah.
Any other questions? Yes, sir.
I have a couple. One, I just want to say, anything that we can continue to help our air quality, we need to do that. That kind of puts it up on a high. It's always amazing when you can go from a $36,000 cost to a $2 million. I almost laughed when I first read it. I kept reading it over and over to see. The one thing I do have a question though on you guys, what is the workload we're asking you guys to take on by doing this? Is that, it sounds like it is quite a thing. You've been working on it for the last year, you said.
About 9-10 months. When you do a general permit, you do the same amount of work. Instead of being specific for a location for one facility, you do a generic that everybody can apply to. So we don't have as many of the details in the analysis because it's a generic permit. The work has been invested up front by the division, working with EPA. They did provide us some really great resources for other state permits. State of Texas was a great one. We saw one from Arizona. So we were able to kind of cherry pick and put it together. So when the application gets submitted now, instead of however many months of review, we figure it's going to be about 100 hours. So what we can do in a couple of weeks, because we did all the work on the front end.
Okay. Very good. Do you believe that this, I mean, obviously I think you do, but to the air quality issue, is this something that we probably, more people need to think about having? We need to see these expand?
Absolutely. I think that we do have a situation with the condition of our forests. Our urban interface, where we're building out into those forested areas, it's going to become harder and harder to set up defensible space. And for a homeowner, you can't afford to have somebody come in and do it for you sometimes. And then if you don't have the skill set to go out and do it yourself, but you go ahead and try anyway, that's where the problems come in. So I think by keeping fire where fire needs to be, operated by the people that know how to handle it, and then also reducing emissions, because we get a significant emission reduction. An air curtain incinerator really is an air pollution control device.
Yeah.
And they work really, really well.
Chief Brown.
Another to your question, there's three ways of removing fuels. There's mechanical, which is one of the most costly. There's people moving it from, forested and our community areas, and then there's prescribed fire. And prescribed fire is the cheapest way to do it, but we just don't see a prescribed fire used as much as it used to in the past, because it does create a lot of smoke. As well, it's labor intensive, and we have problems with that at times. The curtain gives another toolbox to where you're not burning, everything that we can burn out there. You're burning forest fuels and community fuels reductions. These are fuels that are gonna go into the curtain. They burn a lot hotter, which is cleaner. I'm really proud to see that the district's working with fire agencies around here to get this in place. It's been something they've been trying to do for quite some time in other areas of this state and also California. And they're watching really closely, and they're seeing the successes of this, that's for sure. So it's just another means of cleaning up our community and our forested fuels problem. And one of the problems we have too is getting those fuels when we have somewhere, taking them, and where can we get rid of them? This allows that ability to get rid of those fuels again. We look at biomass, we look at everything associated with that. Biomass is great if you have a facility that can receive it. We just don't have any of those facilities that are close enough, so that it's very costly to move it. So now we can take the fuels to one of these two locations, and with the help of the fire services that are involved, get rid of them.
Are these going to be fixed locations, or is this something that can be moved from this part, and next year we're doing this section of fuel reduction for the forest, or?
It's a trailer-mounted piece of equipment, and so part of
Perfect.
the permit to operate will be that they notify us before they set it up.
And we're setting this up right now mostly to benefit Truckee Meadows. Is this something that a private, contractor could do?
As a job?
Yes, sir.
Wow.
Yes, sir. It is now open
Terrific.
to
That's neat.
anybody that would want to use it. If I could just add a little sidebar under the Chief Brown's comments about the state of California. They have a number of these that I've operated in the last couple years in the state of California. There is an exemption that if you have a governor that declares a state of emergency, that you can operate one of these without having the Title V permit. Governor Brown did declare that state of emergency, but it was just recently discovered that in that declaration it said except for permitting requirements. So all of a sudden, all the land managers were notified that they needed to fix this problem, and so they're actually starting the same scramble that we're doing now. So we were getting some frowns from land managers up front that why could they operate it over there and not over here, and now it's kind of flipped the other way that, oh, now we know how we can operate them, and so they're doing a little scramble over there to get their programs set
For a
up,
fee,
so.
can we show them how?
That sounds like a really good idea, but I'm not sure I want that liability.
Good. In this, you're asking us to set forth a business impact statement and to set up the October 25th meeting. And can that be one motion?
Yes.
Okay, good. Do I hear a motion? Okay, guys.
Yes, I make a motion that
Good,
we,
thank you.
for sure, all the things she just said, we want to do that.
Good. We have a motion on the floor. Do we have a second? Second. Good, second from Mr. Delgado. All in favor?
Aye.
Opposed? It carries unanimously.
I
Good
will
job.
see you next month with the rest of the package.
Great, great, great. I think this is just a tremendously good deal, and I really want to thank you in your department and division for taking a big step forward that I know, just by what you sent us in our packet, has to be a lot of paper pushing, so. Okay, moving on to the Mr. Excitement here, Mr. Dowd.
That's a nice nickname. I like that.
Good afternoon, Chairman Novak, members of the board. I'm Dean Dow, President and CEO of RMSA for the record. You have a copy in front of you of our August compliance report for review. I'm available for any questions you may have concerning that report.
Any questions?
My only one question has to do with you, but not necessarily the report. I just also wanted an update. We talked about flu, you guys actually doing flu shots as
Yes,
well.
sir.
I just wanted an update on that. I don't know if that's part of this, if I can ask that, but
We actually are underway for our own employees currently at this time, and we're also setting up to do some work through community paramedics. And I can give you an update maybe through Kevin Dick as soon as we finish formulating that, but it shouldn't be, but maybe another, what, 2 weeks? 2 weeks.
cool. That's all. Thank you.
Very good.
You're welcome.
We need a motion to accept his report. Okay,
Motion to accept.
good.
Second?
Okay, Mr. Brown, second, Dr. Hess, all in favor?
Aye.
Opposed? Hey, it carries. Go forth.
Okay. Again, thank you, Chairman Novak. It's my pleasure to take this opportunity to recap some public and community relations events that we've participated in over the last few weeks. As we noted last month, we were doing what we termed our soft launch of the Pulse Point app. That is now up and operating, and there's going to be an upcoming edition of Health Watch on KTVN Channel 2. Will be highlighted how to access the app, get it on your phone, and utilize it. The second thing I'd like to highlight, and I'd actually like the three gentlemen in the back of the room here to come down and join me. As many of you know, I've got a fire service background, grew up in the fire service, so this next announcement I think is meaningful to me. All these gentlemen, along with a lot of my leadership staff, our education staff, worked on this. But I'd like to formally announce to this body that RMSA Education Department, along with 8 local fire agencies, have cooperated to form a paramedic level training program for those 8 fire agencies. So this has been designed for fire personnel that are currently, if you will, employed in the fire service. It's built around their work schedule. And it's unique, I think, to this area and possibly many states. We're excited to be able to participate in it, bring everybody together to make it work. The camaraderie, the teamwork and effort that went into this was outstanding. We signed the paperwork when? About a month ago? Yeah. And the program itself will start in mid-December. So I'm just going to take a step back and applaud these 3 departments, along with the others that aren't here, unfortunately, today. They couldn't get here, but just applause for everybody for the work that they did to help this come about.
Great, thank you.
Thank you. Thank you, sirs.
Yeah, thank you.
Thank you.
Very good.
Also, as many of you know, this time of year sort of wraps up our special events season. So I would like to give a special recognition to all of our first responders, our communication specialists, our emergency medical dispatchers, EMTs, advanced EMTs, paramedics, the supervisors, support staff, our Our organization fielded over 550 events through this season. And as many of you know, a lot of those are outdoors. It's hot. You're dealing with the weather. You're dealing with large crowds. Sometimes those large crowds aren't the nicest folks in the world. So it's a little bit of a trying situation to deal with sometimes. But I'm very proud that all of everyone collectively got through this season again, and it was outstanding, great teamwork this year with all of our fire partners, law enforcement, et cetera. So just kudos to them for another good season. The last thing I'd like to highlight is on Monday, this past Monday, as we've done for the last 5 years, REMSA has had the honor of hosting the Western Division of the National Emergency Medical Services Memorial Bike Ride. This is an event that started in 2011 in Boston. It has grown rapidly across the country. It is 3 divisions. There's an Eastern, Mid-America, and then Western divisions. This year, we're honoring 79 personnel that have succumbed either to illness and injury, work-related, or straight line of duty deaths. This year, the ride starts here in Reno, or did start in Reno, goes over to South Lake Tahoe, and then for the next several days works its way around the northern part of California through Sacramento, through Napa Valley, and then ultimately on Saturday it will end up in San Francisco. When we started on Monday, we had 18 riders leave here, myself included. And then by Saturday, when we end at Golden Gate Park, that number will probably be up around 40 because it grows at each sort of stop each day as they go along. And I will be there in San Francisco for the ending day. I'm going to ride from Petaluma to San Francisco. So it's our honor to note that. We had a lot of interest this year, a lot of media interest, and that helps it just nationally get attention, raise awareness, and raise donation for the families that are left. So with that, any questions?
Very good. Yeah, yes, sir.
I just want to commend you.
You are awake.
I am. I have coffee today. I'm doing just fine. I want to just commend you guys. I can tell you when we come together regionally on what's happening with our paramedics, it's such a need for our fire across the board because we just know the need. And so from what I get to do on the city level, I thank you, but it's so great that you're working as a region, working together and teaming up. So
Totally agree.
Truly just want to commend you for that. Thank you.
Thank you.
Good. Thank you very much.
Thank you.
Okay. Next item on the agenda is to discuss the process and for our evaluation, annual evaluation of our health officer. And this is something we have to do annually. And Lori Griffith, one of our shining stars, is going to be heading it up for us this year. We will be doing a 360 evaluation on a list. Do you have kind of a presentation for us, please?
No, I don't have a presentation for you, but that's
Well,
okay.
just do a little announcement then.
This is an annual process that we do have to do. In your packet, you do have a list of participants that was provided that we'd like to send the evaluation to. Oh, sorry, Lori Griffey for the record. The evaluation questions are the same questions that have been used for the county manager and for the district health officer for the last 2 years. They have gotten us quite good at rapport from everybody. Using the Survey Monkey, we do get a better response than we did when we were mailing out questionnaires. We'd like your approval to go ahead and start this process, and then we can get you back the results for the next meeting so that your evaluation of Mr. Dick can be done in open meeting and be done right around his evaluation period, which is October 24th.
Good. Questions? Do I hear a motion?
I move we accept your evaluation form. Is that what we're approving? And the process as you described?
Okay.
Okay.
Okay, we have motion made by Dr. Hess. Mr. Delgado was it second. All in favor?
Aye.
Opposed? None? Good. Would you please check on here your email address and stuff to make sure it's correct?
Good idea.
We don't want to take our shining star away from our normal work, so. Terrific, terrific. Okay, we're going on to staff reports. Ms. Albee.
Good afternoon once again. Charlene Albee, Air Quality Management Division Director. I do have one update that I did just receive on September 19th. I received an email from Mr. David Rinaldi, who is the chairman of the Air Pollution Control Hearing Board. Mr. Rinaldi wanted me to let you know that he's submitting his resignation. He's not going to be requesting reappointment to the board. And his comment here is that he was appointed as, or elected as the chairman of the Air Pollution Control Hearing Board in 2002, but he was actually appointed to be on the board 27 years ago. So this is a big piece of what our Air Pollution Control Hearing Board has been built around. He's a certified industrial hygienist, and he has provided tremendous direction and mentoring as we've had our board grow up over the years. He has been on the board as long as I've been here, so this really is a great honor for us to have had him this long, and we are really going to miss him. We did go ahead, upon receiving this, post an announcement that we do have a vacancy on the board. It's open right now. It's posted on the Washoe County site for the Get Involved page for boards and commissions. We have it on the Board of Health, the Air Pollution Division, Air Quality Division, and we'll hopefully be coming back at the next meeting for a reappointment. So with that, if there's any other questions, I'd be more than happy to.
Question, can we reach out a little bit farther than just the county if you're interested to serve? Is that something, an industrial hygienist, group, is that something we can send that application to or announcement to?
It would be really nice if we could, but there's a very limited number of certified industrial hygienists in the area.
I know, but there just might
So
be somebody like this who's got another 27 years in them.
So we are actively looking for another industrial hygienist. We've always found it good to have a representation from each of the areas that we cover, and so we're reaching out and we're making lots of calls. We had a couple of people that we thought were going to be really good and then ran into the requirement that they can't be state or political subdivision of employees. So that's kind of kept us on path. So I do believe that we will be successful in finding someone.
Good.
And we have had interest already
Obviously,
expressed.
that's quite a loss to all of us, so.
Yeah, so we will go ahead and get a recognition for him for the next time. He has relocated to Illinois, I believe, and won't be able to join us, but we'll make sure that we
Where in Illinois?
recognize him. And it's either Illinois
Find out, I
or,
might be able to drop it off. I got to go back and visit
it's
relatives.
either Illinois or Indiana.
Oh,
and I
good.
can't remember which place he's moved to, but he's not
Never
here
mind.
anymore. So. But that's the only thing I had to add, so if there's any other questions on the report, I'd be more than happy to
Any other
answer
questions?
them.
Good. Thank you, ma'am.
Thank you.
Thank you very much.
Okay. Mr. Cutts. Oh, okay. I kind of figured. I looked at them. Yes, sir.
Good afternoon again. Steve Cutts for the record. Just wanted to provide you with a couple of updates. And first, I see Ms. Rogers has our cool pictures up. So this is highlighting our event that we had at Yory Park, Family Field Day in early September. This is Councilman Delgado and his son playing. Some other great pictures of the park. Our chronic disease prevention program partnered with City of Reno and some of the trailer parks surrounding Yory Park and put together an outstanding event that is a great representation of our chronic disease prevention program. Not all staff were there, but a good number of them. Great event to promote the Washoe County Health District. This just kind of gives you the enormity of it and the showing that we had that I think was very impressive. This is the next phase of what we are partnering with the City of Reno and Yory Park. So Eric Burke, who did our mural, the Healthy Living mural over at the Reno Housing Authority just down the street, he is doing some more work for us here with the Yory Park. So he is painting some very colorful walkways and the basketball court. Laura, if you can move that on, please. Yes, thank you. So here you can see part of it sectioned off. People who frequent the park have been very pleasant and respectful of Mr. Burke and his work and staying out of the way, so we really appreciate that. We believe that all of his work will be done by this weekend, and so we'll have some more pictures and another update most likely at the next board meeting. I also wanted to turn it over to Councilman Delgado if he is interested in talking a little bit about that, but he has been working to have some other events at Yory Park.
Thank you, Mr. Cutts. And through you, Mr. Chairman. The event was outstanding and great and amazing. I appreciate all the staff to go out and did all that hard work and making sure that the community bought into it and was present. Several of those managers that live between the two mobile parks reached out to the City of Reno during a public comment and really shared with us that they weren't necessarily feeling safe in their community, and they had felt as though they had lost the opportunities to really engage or take ownership of their park. And so when this event took place, again, really led by the health district, allowed for me an opportunity also to engage with those community members. I don't necessarily represent that community, but they also reached out to me directly, and working with our other council members was able to really hear some of those issues. And someone that's worked with other communities in terms of retaking their community assets and open spaces, it's not just going to take one event, it's going to take several ongoing events to build that community trust. And so some of those, I met with those community members after the event, and we're looking at now doing a maybe special Halloween trick-or-treat event with those neighbors so they can at least start to know each other. And that's what happens a lot of times is neighbors go into their homes, they don't know who lives in the area, they start losing interest, and they start harboring in the homes if they hear or the suggestion that bad activity is taking place. So we're working with them, working with the health district, working with other partners to say, let's make sure there's an opportunity for us to re-engage and take back some of those spaces. And it's going to take some of this artwork. It's going to take some of these other spaces, some other opportunities of working and engaging with those community members. And I wanted to share that. And thank you to the health district. Thank you to Kevin Dick and the board and the staff. That really lends to redeveloping and re-engaging and increasing that quality of life that they all want. And that's what's great is they also want to engage, and that's a big part of it.
Yes. Great, thank you, Councilman Delgado. One more update I wanted to let you know about is there is an update in our family planning section about our partnership with Washoe County Sheriff's Office and how, due to a decrease in funding, we needed to scale it back. We are bringing the female detainees here for family planning services, and I apologize, I'm not even sure I updated Mr. Dick on this yesterday when we had a brief conversation, but surprise possibly, is that as early as mid-October, we believe we'll be able to resume our services up at the Sheriff's Office. We had a conference call yesterday with Captain Jeff Clark and some of his staff, and so we are working on improving the situation and some logistics, and we believe we'll be able to be up there. We know overall it's a much smoother, better process if we can take our services up to the women up there. They're incredibly appreciative. Captain Clark and his staff, as well as NAFCARE staff, have been wonderful to work with. So we're very excited about going back up there, and we expect to be back up there in October. And with that, I would be happy to answer any questions you may have regarding the rest of my report.
Mr. Dare.
I just want to know, can you make sure we know about events that you guys are doing. I don't know if I could have gone, and I know that it's in Reno, and I have a passport, so I'm allowed to travel over there. But I really take serious that we're in a regional board and that what you guys are doing, and just to show support to staff, I think it's always very good. But I did not know about it, and I don't know necessarily when you're having, but I think all of us need to know, not just myself. And if we can stop by, I think it's always good for us when we're having conversations and to support that we are a regional health board. So if that could just help.
Yes, we'd love to have any of you at any of our events and showing support. And as Councilman Delgado said, I think that we were thrilled that he was able to make that family park event, and we appreciate his involvement from not only the Board of Health standpoint, but as a City of Reno councilman. Even though he didn't represent that area, that was awesome that you were there.
Yeah. And bring your basketball game. They have a basketball court there, Councilman.
You're going down.
This thing is degenerating. Thank you, sir.
Thank you.
Mr. Westham. After you got dressed up in the new tie and everything? Wow. We all good? Okay. Thank you very much. Nice report. Ms. Conte, who is filling in for Dr. Todd.
Nothing to add. Any questions, I'll defer to Dr. Todd.
Any questions? Good. I'll tell you what, I like these kind of meetings. Yes, sir, do you have anything to say?
Sorry, folks, I've got a few things I'm going to highlight for you. First off in my report was public health accreditation, and I am really proud of the health district staff who've been working hard for a number of years on the accreditation. This is an effort that started back in 2014 when we had our fundamental review results, and I appreciate Chairman Novak advocating for us moving forward with accreditation. I'm very pleased to announce that right after the board meeting this afternoon, we're going to have an event over in our conference room B, and I am going to push the button to submit the 213, I believe, documents that go electronically into the pile that the Public Health Accreditation Board then reviews, and that forms the basis of our documentation for accreditation, and they'll be out for a site visit within 6 months of our submittal. So big step forward on the accreditation.
Thank you.
And thank you for your support for the entire board for this. And then on the Truckee Meadows Healthy Communities, we had a retreat in September, and was facilitated by Stephanie Cruz with KPS3. Did an excellent job, as I expected that she would. And we came to a consensus that we will be moving forward with the function being a convening role for the coalition and advocacy around the areas of housing and homelessness, preserving mental health, and particularly crisis stabilization, suicide prevention, and physical activity and nutrition, and that being around support for the 5210 program that we've heard from Community Health Alliance on, and is also part of our CHIP. These are really the three priority areas that we identified in our community health improvement plan. So we threw it wide open for discussion, and I thought it was great that we came back around these as the priorities that Truckee Meadows Healthy Communities wants to work to support, and that's fully in alignment with our community health improvement plan. The other thing that, actually a couple other things here with Truckee Meadows Healthy Communities, last night we had a community conversation around affordable housing. Enterprise Community Partners were in town, and they're working with Truckee Meadows Healthy Communities and the Truckee Meadows Regional Planning Agency on the comprehensive affordable housing strategy for the region. And we had about 80 people or more that showed up at the Discovery Museum from 5 to 7 to hear about the strategies that are being considered to provide input for the development of this comprehensive strategy And we broke into groups, had some great discussion and feedback on what community members, and we had some considerable expertise in that room, felt like were the best strategies to be supporting and pursuing. So I felt very good about the input that we got there. Also wanted to mention we do have a Family Health Festival that's coming up at O'Brien Middle School on October 8th from 3 to 6 p.m. And we will be offering flu shots there. We haven't advertised it as such to the community, but it's actually a pod exercise for us too, a point of dispensing for getting vaccines out. With the Washoe Regional Behavioral Health Policy Board, we're continuing to move forward with the work around the BDR for crisis stabilization services, and we formed a subcommittee that I'm participating on that'll be looking at what are the potential cost savings that will result from this so that we can provide to the state basically a business case for this netting out as positive for the state instead of a cost for the state to support those services. And then I'm pleased to report that the Legislative Committee on Healthcare met this Monday, the 24th, and they are moving forward a BDR that will provide for a public health fund that provides $5, an appropriation of $5 per capita for public health that would be provided to the health authorities under 439. So that would be a significant boost in our state funding allocation through the public health fund, and we're hopeful that will move forward successfully through the legislature. Speaking of the legislative session coming up, I believe the board members received the announcement that we are recruiting for a government affairs liaison. And so that is an open recruitment right now that closes on October 3rd. And so if any of the listeners are or know of somebody that would be a good fit in that position, information is available on the county human resources website for that. And then under media activities, we had the presentation earlier from Ms. Parker on flu, and I've got a clip that we had an interview that Mr. Ulibarri organized with Lenny Shore earlier in the month to help promote flu vaccinations. And I also wanted to thank Councilman Dare, who showed up and helped us out with also some media publicity around flu, with getting his flu shot earlier this afternoon, and we had TV coverage from KOLO, KRNV, and KTVN, all three stations for that event. So we are continuing to work, and I understand that Mr. Dare was very brave, didn't even flinch when he got the shot.
You know, the part that was scary is they made me take off my shirt. So I think that this whole region's going to see part of me that they never anticipated.
Can we just limit that, please?
I hope so. I hope they zoom in.
They may do some editing on that.
We'll get you a popsicle in a minute.
If we could have the.
Flu season is coming up fast, and health officials are urging the public to schedule your flu shot now. Stores around town have already started to offer the vaccine, and the Immunization Program Director for the Washoe County Health District says everyone needs to sign up this year. She also busted some myths for us, including one that says you will get the flu because you get the flu shot, or you got the flu shot. She says that this is not true.
If you get a flu shot and you suddenly come down with flu symptoms, it's not because you got the flu from the flu shot. You were either exposed, or perhaps if you have mild symptoms like body aches or fever, it may be a good sign that your immune system is revving up and actually going to protect you when that flu hits you.
For more myth busting about the flu shot, you can head to our website, mynews4.com. There you will also find a list of locations where you can get the vaccine.
So watch for Councilman Dare on the local news this evening. And, that concludes my report.
Good, thank you. Just so for people that don't know, this public health funding that our Senator Julie Ratty, that used to be on this board, is bringing forth even if we get this approved, it's gonna bring us up to what, 49th in the country as far as funding? Right now, we're 53 out of 50 states. That shows you how far behind we really are. So I really hope we can get this one done. We have a few projects that are really nationally known projects, and Miss Albies, her firebox idea comes out. These all take time, effort, and money, and it's public health money ultimately. So we're spending wisely, but boy, we could sure use a little help. So if you want to write a nice thank you note to Julia Ratty and keep her going, that would be appreciated. So.
And if I might add,
Go right ahead.
Senator Spearman, who
Oh,
is
Senator Spearman.
chairing
I'm
that
sorry,
committee,
yeah.
was really
Thank you
also a
very
champion
much.
for us
So-
there.
Okay, next item, do we have any board comments, or anything to go on agenda items for next time? Hearing none, move along. We have one public comment from Mr. Passow. Three minutes, please.
Absolutely.
Go ahead.
Speed talker. Good afternoon, Mr. Chairman, rest of the board. My name's Brian Passo, P's and Peter, ASSOW, first of Brian, the correct way with an I. I am the emergency manager for the VA Sierra Nevada Healthcare System, with our medical center, of course, and operations based here in Reno. Our catchment area covers some 26,000 square miles, that being most of northern Nevada and a sliver of northeastern California. In addition to our mission of providing health care for our veterans, we are also tasked with a facet of the National Disaster Medical System as a federal coordinating center. The mission of the FCC is to receive, triage, stage, track, and transport inpatients of acute care facilities affected by a disaster or national emergency to a participating NDMS, or National Disaster Medical System, medical facility or definitive care provider, capable of providing the appropriate level of care. Locally, those are our community partner hospitals, Renown, St. Mary's, Northern Nevada, and we've even partnered all the way down to Carson Valley Medical Center. 50 miles is my limit for providing care. And FCC also has the potential to receive military patients should the Department of Defense Health System and the Department of Veterans Affairs Contingency Hospital System be overwhelmed during a military contingency. As an FCC, we are responsible for day-to-day coordination of planning, training, and patient reception area operations in this geographic area. The NDMS may be activated in one of three ways: under the Robert T. Stafford Disaster Relief and Emergency Assistance Act, the Public Health Service Act, or the Overseas and Domestic Military Contingency Emergency Plan. Partially listed above, our federal partner agencies consist of HHS, who has the overall ownership of this program, the National Disaster Medical System. They also handle the patient and manage the patient tracking system, known as JPATS, or the Joint Patient Assessment and Tracking System. And they also handle the funding stream, taking care of these patients and repatriating them once the disaster zone has been stabilized. The DoD, that's our transport asset. We utilize the Air Force C-17s and C-130 aircraft in the patient transport configuration. Local hospitals, our community partners here, are, as I stated, all of the community hospitals are signatories to the National Disaster Medical System as definitive care providers. Washoe County Health District as our communications and transport conduit, and REMSA, obviously, for their ground transport capabilities locally. They both help additionally with surge tracking and ground, and like I said, is the ground transport. So, with that being said, on August 28th, the VA sponsored and in conjunction with the 152nd Air Wing, hosted the first FCC full-scale exercise in Northern Nevada. This exercise brought an Air Force C-130 aircraft from Georgia, picking up the Air Force Aeromed EVAC 156th EVAC wing from Charleston, North Carolina along the way, which is kind of appropriate because they ended up with this mission right on their plate as Hurricane Florence a couple weeks after we held this exercise. We also brought in 3 area emergency managers from the Veterans Headquarters Office of Emergency Management, one from Northern California, one from Oregon, and one from Utah to play the role of HHS assistance teams, giving some just-in-time training to some VA personnel in the patient tracking system. Locally, the exercise consisted of VA Medical Center personnel as the flight line operations and reception clinical teams, the Washoe County Health District's EMS coordinator, Brittany Dayton, in her capacity as a medical unit leader and assisting as under the Mutual Aid Evacuation Act, we call the hospital technical specialist. And last but not least, of course, our REMSA partners, led that day by their emergency manager, Brian Taylor, with multiple ambulance units dedicated solely to this exercise, distributing actual patient actors to the community's hospitals. I'm here today to specifically highlight the successes of the Health District's Mutual Aid Evacuation Annex processes and the patient tracking function under the WebEOC system that Dr. Todd had put together and meticulously updates and maintains for us. The joint patient, the JPAT system that nationally is used, that is how they send the patients over here. Once they get to our region, we utilized the back half of the tracking system. I know Brittany has come in the past and presented the evacuation documents and the mutual aid evacuation annex processes. However, the reason I'm highlighting this is because during the exercise, a real-world failure of the national system occurred for about 2 patients. However, during that time frame, our hard copy of patient transport and patient tracking were in effect, as well as the WebEOC system. And once the national system came back up online, we were able to repopulate that information back into the system. In addition to this, fail-safe, our redundancies, the WebEOC system locally was able to accomplish something that our national system could not, in that it allowed for transferring from an acute care facility to a subacute or specialized facility. As it stands now, the NDMS system does not allow for anything except for acute care facilities to sign out as definitive care providers. We're working on skilled nursing facilities and the like, but at this time they do not have that. This system was able to be updated, getting the information transmitted to us from Northern Nevada Medical Center at the time, going to a specialty geriatric behavioral health location. So this patient tracking capability that is managed by the Preparedness and the EMS folks, as well as, and of course, Dr. Todd, was a key component and was looked at as a best practice of co-locating our patient tracking, our local patient tracking system with the JPATS management team at the time. So I'd just like to say thank you for all the support from the Health District and from our EMS partners. Thank you.
Thank you very much.
Any questions?
Next time, with something this important and information for the board, can you go through Ms. Conte or Dr. Todd and get this as an agenda item?
Sure.
And that way I don't have to worry about limiting to 3 minutes for public comment. This really wasn't a public comment, but I think it's extremely good information to keep us as a board and health providers into this. So they can very easily get this an agendized item.
Very good.
Thank you very much.
I kind of wanted to surprise Christina.
Well, it did.
This was a big thank you, so I appreciate it.
Thank you very much. Okay, hearing no other comments, we will stand adjourned at 2:44. Thank you all. If you want to come over and watch the button pushing, come on with us.
Very exciting.
Cake and